Thank you, Professor Falk. I'm very honored to present what I have in mind. Today, I want to share about the social changes after the outbreak of the global infectious diseases. In the 2000s, there were 4 pandemics. These were SARS in 2020, 2002, H1N1 in 2009, MERS in 2015, and COVID-19 in 2020. Scopus, which is Elsevier's abstract and citation database, has the largest number of academic journal data in the world and was used to understand social impact after each of the global infectious disease. Each infectious disease name is entered into the database as well as the influence, impact, and effect as keywords to see the resulting social changes. For example, in order to examine the social change after SARS, we searched articles on the social impacts of SARS from the outbreak in 2002 to the outbreak of another global infectious disease, H1N1, in 2009. As you can see in this slide, when we divide the social impact of infectious disease by period, we found archives of 80 articles on SARS, 142 articles for H1N1, 23 articles for MERS, and 1,864 articles for COVID-19 dated up to the last month, November. If we included search for articles about related medicine or science and technology, we could find many more articles, but we have limited them to social science articles. Nevertheless, as COVID-19 was a very significant event, we found over 1,800 articles. We conducted a topic analysis for the title, keywords, and summary of the paper. We drew a network by keyword to see which words cluster by topic. This allowed us to see social changes. Take a look at SARS. We limited the search to 5 topics and examined which keywords were gathered in each cluster. As a result, the world economy, industry, employment, and jobs formed a topic. As you might guess, when an infectious disease breaks out, the economic shocks comes the fattest because movement is limited and tourism industry is immediately affected. Related jobs are decreasing. Production is decreased by reducing various consumption types. The second topic concerns stigma, fear, and recovery. After SARS, not only the infected patients, but also medical personnel who took care of them have been socially alienated. Of the public health workers who cared for patients in Taiwan, 10% among them suffered from trauma that makes daily life very difficult. The keywords environmental destruction and quarantine also form a topic. These words appear whenever a global infectious disease emerges. As with COVID-19, SARS is also zoonotic disease, and wild animals that were displaced from their natural habitats due to the expansion of urbanization are transmitting the virus through contact with humans. The government's agile response also forms a topic. The success of infectious disease control depends on how quickly the government collects and distributes medical stuff and public medical resources. Now look at H1N1 that shocks the world in 2009. Unlike SARS, new keywords stand out. First, I saw the words government and policy associated with SARS, but the word community is newly interwoven to form a topic during the period of H1N1. Government policy is also important, but this suggests that local communities must work together to respond to the infectious disease. Another new topic is a group containing words such as system, data, analytic, patterns, etc. At this time, experts around the world try to scientifically analyze the spread and effects of infectious disease. The world's big data, simulation, and the systemic analysis allude to this effort. During the H1N1 period, governments responded by creating and disseminating specific guidelines for action by remembering the experiences gained from SARS. Social distancing, restrictions on movements, and medical ethics of travels that we are familiar with today were focused on this period. Schools and workplaces with infected patients had been closed, and the government provided financial support to small business and individuals who had suffered economic damages. The word surveillance and communication also form a topic, as well as monitoring the movements of the people infected. The paths on which they moved were disclosed, calling attention to these infected cases. During this period, some scholars used the term biosurveillance, which means that not only humans, but also animals and plants should be included as targets to detect abnormalities. Now let's look at MERS. The first identified case occurred in Saudi Arabia in 2012, but the outbreak occurred in Korea in 2015. Some characteristics were found. Social media, SNS, was the most outstanding word. With the widespread use of a smartphone, information related to infected people and medical information about MERS had rapidly spread through social networks. This is why many rumors were being spread. At the time, the Korean governments failed to respond in the initial stage, and this situation was greatly criticized through social networks. Another characteristic found during the MERS period was the communication between citizens and governments. As mentioned earlier, the governments did not disclose information on infected people in a timely manner, which resulted in ongoing spread of the epidemic. We realized that the response to infectious disease is effective when the government discloses all information transparently to citizens. Finally, let's look at the coronavirus we are experiencing this year. Since over 1,800 papers have been published in the social science field. That will be much more if other fields are combined. Thus, it can be seen the social impact of COVID-19 is so great that it cannot be compared to previous infectious disease. This slide is a topic network that shows social changes after COVID-19. The words risk perception and community are clustered together, and education and online schools form a cluster. Lockdown, local lockdown forms a cluster with the words economy and policy, and jobs, family, food, etc. also tied together. Social distancing is linked to the market. The summaries of over 1,800 papers comprise a variety of words. We wanted to draw a much more detailed network of these words to see the connectivity between them. So we analyzed the index keywords specified by the authors of the articles, and we obtained the graph as shown here. We found words that we couldn't see on the topic network earlier, which was very interesting. The words economic crisis, social fiscal policy, and law enforcement linked to public health, which form the largest hub. The keyword healthcare can be seen as suggesting that it is inseparable from the economy, society, and quarantine. This means that convergent policy that encompass these fields should come out. The word lockdown, which occupies a large hub in the network, links stress, depression, mental health, and resilience. Another noteworthy point is that regional closure is linked to domestic violence. The problem is that domestic violence is on the rise as the number of people living at home increases due to social distancing and local closures. Domestic violence is found to be particularly severe in Asia. Education has also turned out to be a serious problem. Due to social distancing, students of both elementary and secondary schools, as well as those of universities, are receiving distance education. Medical care is also providing telemedicine temporarily. In recent years, the trend of digital transformation has been a driving force for social change, and it has been applied very radically after COVID-19. Just as we now have an online conference, online video conferencing is no longer unfamiliar. Interesting changes that can be found in social change after COVID-19 can be detected in a group of words: climate change, global animal law, and interspecies communities. It is analyzed that these words appeared because of a zoonotic disease. In some cases, animals transmit the virus to humans, but in other cases, humans transmit the virus to animals. In the United States, people infected with the coronavirus have also infected their dogs and cats. The global animal law insists that each country has different laws to protect animals and prevent abuse, which must be unified. Another worrisome incident in social change after COVID-19 is racism. The word racism is linked with a social structural injustice and bioethics. As we are experiencing racism around the world, we can see that more social anxiety increases, the more socially weak are suffering. Let's briefly summarize implications of our study. Social issues that have been experienced in all periods since 2002 include economic shock, psychological anxiety, quick response from the government and cooperation with the international community, and environmental destruction as a fundamental cause of a pandemic disease. The characteristic issues for each period include resilience, social stigma, and psychological anxiety during the SARS period. In the H1N1 period, scientific analysis of the spread of infectious disease and biological surveillance are cited. And the MERS period, the reliability of citizens and governments and the spread of response information through social networks are highlighted. During the COVID-19 period, words such as social fiscal policy, increased inequality, lockdown, depression, domestic violence, distance education, digital transformation, climate change, and interspecies community appeared. Social issues that continue to appear in each period are considered to require innovative responses. This is because as a result of covering the problems without solving it, problems continue to occur. Global infectious disease have occurred frequently since 2002. The cycle of occurrence has also been shortened. It is impossible to predict which new virus will appear in the future. If reckless organization, destruction of biosafety, and environmental pollution persist, we will continue to experience global infectious disease more frequently in the future. Since our outbreak of infectious disease, healthcare, economic, and social problems and quarantine have become one body and are causing complex problems. Social distancing for quarantine regions is fatal to the economy, and the socially weak suffer more in this process. While considering social stability first, policies that minimize economic damage should be devised. To do so, the government should focus its response efforts by securing necessary medical staff and medical resources in the early stages of infectious disease. In order for the government to move very quickly, its social trust must be high. Otherwise, the people will not follow. Mental problems, trauma, and fatigue should also be treated as important social issues. In addition, the scientific and technological community must have a system to quickly develop infectious disease, diagnosis, treatment, vaccines. These problems are the challenges to which society must put forth its full power. Okay, this is our last slide. We should also pay attention to new social changes that have emerged recently. These emerging issues are currently difficult to evaluate. Continuous observation is required. And it is expected that biological surveillance system that monitors not only people but also animals and plants will be eventually installed in each country and around the world. Observation should be made to ensure that such biosurveillance systems do not violate individual privacy. And it is necessary to consider to what extent it is possible to limit individual freedom for public health. With the rise in contactless communication, telemedicine, distance education, and telecommuting are spreading, a serious discussion is needed on how this trend will change our life. The development of distant medicine, distant education are asking us what values and goals medical practice and education should pursue. We should also be wary of a spread of fake news online. The WHO defines fake news as that which has not been scientifically verified as infodemic and calls for caution. In addition, there will be a cure and vaccine for COVID-19 in the future, and rumors may spread for various political purposes. In 2003, rumors related to the polio vaccine hit Nigeria, and the vaccine was not administered for 11 months. In the meantime, the polio virus had spread to more than 20 countries. Rumors at the time were that the United States had laced polio vaccine with infertility hormones with aim to bring the Islamic race to extinction. Okay, this is the end of my presentation. Thank you for listening.